Hello people, how are you? I hope all of you are good. I have recently passed MRCS Part A exam. Many of you wanted to know about MRCS Part A exam and how to crack it. Today I am going to share how to crack MRCS Part A in first attempt and with minimum duration. First of all, what is MRCS? MRCS is the membership of Royal College of Surgeons. It is an intercollegiate exam for surgical trainees who wish to become a member of one of the four surgical royal colleges in the UK and Ireland. Although it is a postgraduate exam, but you can get GMC license to practice in the UK through clearing MRCS. What are the opportunities of MRCS in the abroad? You can get UK GMC registration in the Middle East countries. There is good opportunities who hold a MRCS degree, and many other countries you can pursue surgical training. In the perspective of Bangladesh, after completion of Part B of MRCS and second year 2-year training, you can start SCPS Part 2 training without appearing midterm exam. Who should sit for this exam? Anyone wants to pursue career in surgical faculty. Any surgical specialty can sit for this exam except ophthalmology. Requirements for this exam: primary medical qualification acceptable to the GMC. That means you can sit for the exam just after passing MBBS. There is no need for IELTS. No surgical experience is needed. If you have experience, it's good, but not that much significant to pass Part A. When should you go for the exam? When you meet the eligibility criteria and when you are confident enough. As soon as possible after MBBS if you want to pursue surgical career in the UK. Now, booking the exam. There are four Royal Surgical Colleges: England, Edinburgh, Glasgow and Ireland. Exams are held on 3 dates: January, May and September. Currently, the exam fee is £578. You will see a preface like this in the Royal College website. Seat booking regarding MRCS party. You can give MRCS party in Bangladesh. You have to book your seat approximately 1 to 1.5 months before the exam through Pearson View website. They will inform you when booking window will be open. Now there is no shortage of seat in Bangladesh. Exam format. The exam is divided into two parts, Part A and Part B. Mark distribution for Part A. Paper 1 contains 180 marks, Paper 2 contains 160 marks, total 300 marks, and the time duration of this exam is 300 minutes. That means 1 minute for each question. All the questions are single based answer, 5 options for each question, no negative mark. This exam is computer based, which will be conducted by third party called Pearson View. Now the important thing, that syllabus for Part A. The Part A has two papers, Paper 1 and Paper 2. Paper 1 is Applied Basic Sciences and Paper 2 is for Principles of Surgery in General. Paper 1 that contains Applied Surgical Anatomy 75 marks, Applied Surgical Physiology 45 marks, Applied Surgical Pathology 37 marks, Pharmacology as applied to surgical practice 8 marks, and Microbiology as applied to surgical practice 7 marks. Imaging and data interpretation and audit total contains 8 marks. In the paper 2, Principles of Surgery in General, the contents are common congenital and acquired surgical conditions 45 marks, perioperative management 35 marks, and perioperative management is an important topic for passing MRCS Part A. Assessment and management of patients with trauma 30 marks, surgical care of children 7 marks, medical aspect of surgical practice 3 marks. How to prepare for MRCS Part A? The preparation duration depends on the person, but in generally, if someone study 3 to 6 hours regularly, it may take 3 to 6 months. And it is important to study according to RCS guideline. And it is also important to solve as much questions as possible. This will help you to understand the question pattern. There are some resources recommended by the Royal College of Surgeons. Basic anatomy textbooks are Grant's Atlas of Anatomy, Nitter, Physiology, Gannon's Review. For pathology, Robin's Basic Pathology. Clinical textbooks are Bailey and Love's Short Practice of Surgery, Principles and Practice of Surgery. The examinees mainly follow other resources. These are EMRCS. It is a subscription based, or you can collect the hard copy if you can get it printed. And Sala Ammo Notes and Reda Notes. Sala Notes and Reda Notes are the collection of MRCS question descriptions and past test. It is also subscription based, or you can get it printed of the PDF copy. Basic Science for MRCS by Raftery. Some other very important resources are recalls. Recalls are the questions that came in the previous exams. Salah bullets. These are the summary of recalls and EMRCS questions. Salah bullets is for the last moment preparation or revision. Fauzier sheet. Fauzier sheet is a collection of 300 questions that come frequently in the exam previously, but nowadays that much question doesn't come from Fauzier sheet, but it will help you to understand the question pattern that come in the exam. And the explanation in the Fauzier sheet will help you to answer many other questions. Guideline and important links. I am very much grateful to these groups. They help me so much. You can join these groups, and I can bet you that you will be benefited from these groups. The two groups that I followed for MRCS Part A exam are Master the MRCS by Dr. Bishoy sir and MRCS BD. Now, what are the resources that I have used? I started to take preparation almost 6 months before the exam, but first 2 months I did not study that well. I started full page study from February 2021. Resources that I used for MRCS Part A exam are EMRCS mainly and Nitter for Anatomy Atlas, recalls. Those are previous year questions, Salah bullets, Fauzier sheet, and group study. It is very much important to study in a group. If you do not study in a group, you will lose your motivation because it is a long journey. It takes 3 to 6 months minimum to take preparation for this exam. Where to find these resources? You can find these like EMRCS or past test from their respective websites as subscription or PDF. These are available, the groups I mentioned above. And in Bangladesh, you can buy EMRCS or other resources as hard copy from Milkhead. Finally, some suggestions from me to pass MRCS Part A easily. Start with systems that carry the highest marks like anatomy, physiology, trauma, perioperative management, and orthopedics. This will carry the maximum marks. So if you can understand or solve these topics, you can easily get passed. Follow a guideline. If you follow Master the MRCS Part A group, then you can easily get a free guideline. Again, study in a group. Focus on minimum materials, but study those well. Study pathology after completing all the other topics. Again, study pathology after completing all the other topics. Take mock regularly. Again, stick to the guideline. Solve recalls in group and start as early as possible. Now, some topics from which frequently questions comes. You can take a screenshot of these topics. Dermatomes, lymphatic drainage, nerve injuries, ABG, vertebral levels, foramen of skull, embryology, GCS, ECG, vitamins, CRT, electrolyte imbalance, respiratory functions, wound management, fracture pattern, pediatric orthopedics, congenital GIT problems, burn, ATLS. Now you have a basic idea for how to start for MRCS Part A exam. And finally, I want to recommend some materials and tips so that you can pass the MRCS Part A exam in first attempt and in the minimum duration and with minimum effort. For this, you have to study in a group. First of all, start studying with MRCS, solve all the questions of MRCS and understand the explanation after the questions, and read the description below the question of EMRCS. You have to complete the EMRCS at least for 3 times. After completion of EMRCS 1, you should start solving recall questions. As like EMRCS questions, you should also solve the recalls at least 3 times. After completion of EMRCS once, you should study EMRCS and recalls simultaneously. After completion of EMRCS twice and recalls twice, you should study Faucier sheet. And after completion of EMRCS and recalls twice with Faucier sheet twice, you should go through the Sala bullets. And finally, in the last month, study EMRCS, recalls and Faucier sheet and Sala bullet at least once. Follow these tips and study in a group. I again insist you to study in a group. You will realize this advice when you study in a group. If you have any other queries regarding MRCS Part A, please comment below. I will try to make you clear. And if you want to know how to book for MRCS Part A exam, how to book the seat in the PRC, comment below. I will make a separate video for that.